Hi everyone, my name's Dr. Siobhan Hickling and I'm the coordinator of the Postgraduate Public Health Program here at UWA. The Postgraduate Program for Public Health sits within the Faculty of Health and Medical Sciences. Now I'd like to commence today by acknowledging that the University of Western Australia is situated on Noongar land, and I'd like to acknowledge that the Noongar people remain the spiritual and cultural custodians of their land, and they continue to practice their values, languages, beliefs and knowledge. So thank you everyone for joining us today for our live Public Health Careers panel. Today we're joined by one of our public health alumni and two of our students who are just about to graduate. So I'm going to ask each of the panellists to introduce themselves. So Elsie, would you like to introduce yourself?
Thanks, Siobhan. Hi, I'm Elsie Blay. I graduated in 2016. I'm currently the Executive Manager of Strategy and Projects at Rural Community Services, and we focus on providing mental health support, housing and homelessness, and domestic violence to the community. Previously to that, I was working and lecturing at Murdoch in nursing, and previously to that, project managing for Silver Chain since the MPH degree. So really absolutely loved it and really keen for tonight's session.
Wonderful, thanks Elsie. I'll throw over to Sophie now, who is due to graduate at the end of this year. So Sophie, could you introduce yourself please?
Hi everyone, I'm Sophie Glassford. So I'm in my final semester of the Master of Public Health, and I'm currently undertaking my practicum, which I'm doing a research project for the University of Western Australia. Prior to that, I was just a mum with two kids, and I was traveling a lot. And prior to that, I did my undergraduate in health science, where I majored in health promotion and nutrition.
Wonderful, thank you Sophie. And Caitlin, if you can tell us where you're at with your practicum at the moment too, thank you.
Sure, so like Sophie, I'm undertaking my practicum at the moment and I'm set to graduate at the end of this semester. Prior to starting my master's last year, I was a business analyst in the financial services sector after completing an undergrad of commerce and arts communications, but decided that I had a passion for public health, so I've come back to uni to help transition into a career in the health industry, and looking forward to hearing all your questions.
Wonderful, thanks so much Caitlin. So within the Master of Public Health program, there are a number of options for students. The three main pathways are coursework, dissertation and practicum. So what I might do is just open the questioning. Did having a master's help you get a job? So why don't you answer that one now, Elsie, and then tell us about the practicum.
Yeah, sure. So I think I applied for quite a senior job straight in the last year of my degree. So I applied for a national project manager job, which was, quite a steep learning curve, and I got that through being in the final year of my postgrad. I think definitely the master's did help, and it helped in the way I was able to translate my undergrad, which was quite a practical, a background of nursing, where you obviously apply for a job as a nurse and you work as a nurse, into kind of anything I wanted it to be, whether that was project management or risk or health promotion. I was looking at jobs that I found interesting and that I had a values alignment to. And I think, when I was successful for that job, yes, it helped that I had a master's, but I think it was what I learned about myself and my career and my passion in that last few years of the master's that was what kind of made me successful in getting that job. So I think definitely it helped that I had a master's. And I think with that, it was really kind of the maturity and the seasoning of who I was. And, I'm sure that passion came through in that, how I wanted to use that. So I think, yeah, it definitely helped. And I think, as with everything, it depends on the employee. Some people are not so academic and they'd rather that you have more experience. Well, I only had so many years experience. I couldn't help that. I was young, I guess. But yeah, I think definitely it was effective for me. And doing the dissertation, the experience for me was working full-time in quite a new role as a project manager. So I'd gone from a background of emergency nursing, where I used to walk from Charlie's down to in my scrubs down to UWA. And then, my first kind of role in an office, which was really different, doing my full-time dissertation, which was really great. So, I was able to kind of go in early in the mornings, leave maybe an hour later in the evenings and work that in. Work were really supportive. Having a logistics, having a setup where, you've got, two screens and you can do your dissertation. It worked really well. It was like kind of having another project. The feedback was really good. I was really challenged by the dissertation questions. It was, different from anything I'd done before. And so the support from Ian Lee and the team they were really patient with me, not having any stats background. Yeah, so it was a really positive experience.
Brilliant, thanks Elsie. I might ask you another question if I can, because you mentioned you're working at the same time as studying. How did you find that experience?
Yeah, I think it was brilliant. I mean, so initially when I started the degree, I was doing working at Charlie's as a nurse, and I'd walk over. It worked perfectly with the shift time. So I think 3:30 we finished a shift, and I'd walk over to my lectures, and then kind of be home by dinner, which was really good. And then when in my last year doing the dissertation's really flexible in terms of the hours that you put in, whether it's in the evenings or early in the morning, and it definitely. I think it helped me in my role as well. It worked both ways. I think there were people in my job that could help me with research and, things like that added to the strength of that. So yeah, it was definitely a benefit in working. I was always working full time and studying.
Right, brilliant. Thank you, Elsie. Caitlin, perhaps you could tell us about your experience now in the practicum. You're about halfway through the practicum, is that correct?
It is. So this is my 6th week. I did start a week later than everyone else, but I'm still set to finish on time, which is, I think Elsie touched on it, the flexibility of the course in general. I worked last year as well while studying, and there's a lot of flexibility in sort of making it work to what you need it to do. So my practicum, I'm currently with PwC as part of their health consulting team, and I've worked across 3 different projects so far. So having the diversity and working with different clients as well within the health industry, and being able to draw on different aspects of the masters that I didn't even think that I would need to use in this situation. But it gives you, the masters helps you practice critical thinking and problem solving, which even if, like, no matter what job you go into, they're really critical skills. And I'm sure everyone else here can agree with me. You meet such diverse people as well, which helps translate into whatever role you go into at the end.
Wonderful. Thanks, Caitlin. Now, Sophie, I'm going to ask you about your practicum experience first, but just beforehand, what was your favourite unit of the course? And before you answer that, just know which units I coordinate, and you can answer anything that you like.
Absolutely. Actually, Siobhan, one of your units was my favourite, Public Health in Nutrition. It was phenomenal. And another unit that I really enjoyed was Qualitative Research Methods. And that led me to go into my research project where I could choose whether I was going to do quantitative or qualitative research. So I really enjoyed doing that unit and then being able to use all that knowledge and skills in my research project. But all the core units, I have to say, have been phenomenal. They've kind of provided the framework for everything you need to know in a research project.
Brilliant, thank you. And which unit do you think has helped you the most in your practicum at the moment?
In my practicum, I would say it's probably been a combination of units. That would be both epidemiology, qualitative research methods, as well as biostatistics, because I am going to be setting up the next stage of the project as well. Yeah, I can't really pick one because it's definitely collective, but I would say qualitative research methods for this specific research project, with coordinating all the focus groups, has definitely, it's definitely right up there as my favourite.
Brilliant, thanks, Sophie. Now, Elsie, do you think the opportunities in the public health work area are growing due to COVID?
Yeah, definitely.
Impact on your workplace at the moment?
Yeah, definitely. I think, everyone's an epidemiologist at the moment, aren't they? There's competition to be, everyone. I think, building on what Sophie said, definitely it's hard to pick a favourite subject or a favourite part, because I think one of the real benefits I found in the degree was the breadth. And, the work I'm doing now, although it's strategy and projects, that means everything. So, you might be doing epidemiology one day, and I'm not an epidemiologist, but I know enough and I know where to find the information now. So I know where something fits and what category it lives in. And if I need a deep dive into that, I know where to go. And same with nutrition. I'm by no means a nutritionist, but I know enough to be able to navigate through that and find the linkages. So I think that's something that's really beneficial. And yeah, definitely linking to COVID. I was doing a piece of work with the Department of Health during COVID, and they're kind of linked. I think having an MPH it's a great time to have an MPH working in health, and also with a nursing background, the two go really well together. I've picked up, for example, our infection control portfolio, which there's probably people out there who are more experts in infection control, but you just get in there and do it. Recently put together a video for the Mental Health Commission about how to put on PPE. I think just having a background in public health, people know that you know enough to be able to find the right information, and and we do make sure that we know the valid facts. And there's so much risk at the moment with people speculating different ideas and things like that. So just
Brilliant.
back to basics almost in knowing what research to find.
Yeah, thanks, Elsie. Now, either Sophie or Caitlin, can you describe the process of choosing your practicum and whether you chose it, what options were available to you? So perhaps
Do you want to go, Sophie, or do you want me to go?
Yeah, I can go first if you the options available for the practicum, Siobhan?
Yes. The question is, did you choose your practicum organisation and how much choice is there?
Yeah, so I did. So we had a list of all different practicums we could choose from. I knew I wanted to do a practicum as opposed to a dissertation like Elsie. And from that list, we got to have preferences of 2 practicums that we wanted. So one of mine was a research project at UWA, which I got, and others are at other agencies, such as Caitlin's at PwC. So if you don't get your first preference of practicum, they'll give you your second preference if you're set up for that. And I was really excited that I got one of my preferences because the research project has been incredible. I get mentored by 2 incredible academics. I get one-on-one training, one-on-one input. You're completely supported in the role. So it's been a really nice transition from going to a student to gradually becoming a public health practitioner whilst having all that support. Brilliant. So I might go to Caitlin though, because she's on an external agency at PwC, so it might be a bit different.
Great, thanks, Caitlin. Just
Yes.
while you're answering too, Kate, and one of the questions is how long does the practicum take? So if you could describe the length of the practicum too.
Yeah, sure thing. So mine was a little bit different in that PwC ask you to apply for the role. So that's a cover letter, a resume, and then I had to do an interview, which involved a case study as well, which is like problem solving within the interview. And then based on that, PwC select their prac student. So one of the best things about prac is that it goes for the whole semester. So it's a 12-week or 450 to 490 hours. And not every Friday, but I think it's about every second Friday, roughly, Sophie, would you say?
Yeah, every second Friday.
Yeah, we have a tutorial where we get together and Danny, who's our unit coordinator, will help us debrief the week. We get to chat with each other, hear what we're all doing, and then practice things that we might be nervous about doing. So we have to give a presentation at the end to our agency for about 20 minutes. So that's something that we've all said we want to practice throughout the semester is public speaking. And then we also get to know each other. So Sophie and I get to hear about what we're up to. If we're having challenges at our agency without breaching any confidentiality, we can discuss how we might tackle different problems together. And I think that's something that I hope I've been able to bring to the TUTE at least, is from my work experience of being a grad before and sharing different challenges that I face to some of the other students that are coming through who might not have worked before. So I hope that answers the question.
Wonderful. Thanks, Caitlin. Now, would anyone like to comment on whether volunteer work can help you with future jobs?
Yeah, definitely. I can start off that one. We have a lot of volunteers apply to work with us in my role. And I guess we've got some kind of tips for people wanting to do that, would be that it's a really competitive market out there. And I think whatever you can pitch as your value add is so important. So the volunteers that are successful with us mostly will get jobs. So and I think that's the case for a lot of agencies. If you're useful and you're plugging holes that need to be plugged at the right time, that's what you want, because it's such a real test about what someone's like as an employee. If you can get in and get the job done and fit in with a culture, that's absolutely massive. I think what's really important is that you kind of stand out, and that when you're there, you really sink in and learn and put in the maximum effort you can. I think what's really important to understand is that it's a really competitive market, and the advantage of putting the effort in and getting a job is so worth it. So I think, yes, volunteering definitely has an impact on your role. And I think when I'm looking at resumes to employ people, you can really tell people who have done volunteering and maybe have it on their resume because they've done it. And you can really tell people who have a strong reference and they've got portfolios or work to show of what they've done. We ask now, or I ask when people are applying for pracs with us, if they can show some work they've done. We get so many applications, and it's just a real point of difference to be able to know that even the question that we ask them's answering the question, like real basics, but really is important. So I think definitely volunteering counts, but think about how it can be meaningful. A tick box probably isn't enough, so you really need to make sure it's the right fit and get references out of it, because people, if you put in the effort for them, people will always give you a good reference if you've been successful.
Thanks, Elsie. And another question for you, Elsie. Has your clinical experience as an RN helped you in your career in public health, do you believe? Yeah,
absolutely. I'm very proud of being a nurse, and that's at the pub I say that I'm a nurse because it's a bit more difficult to explain what strategy and projects is.
Although everyone knows what an epidemiologist is these days. So.
Yeah, exactly. Yeah. So, no, it's definitely helped. And I think, I maintain my registration through teaching and, always will. The match of those two together is really a really fantastic career move that I probably didn't realise how good at the time. A lot of clinicians are in senior leadership in health. So my CEO is an RN, my colleague who's the Chief Operating Officer is an RN, just recently done a board director's course, and a lot of the CEOs I'm meeting are RN. So they're like in disguise. I didn't realise how many were out there. So I think it's also a good going into public health with that background. But what you can bring in the sector in terms of understanding people, understanding disadvantage, Aboriginal populations, and that really kind of compassionate but clever approach to public health. Yeah, I think it's a fantastic combination.
Yeah, brilliant. Thanks. I must say what I really enjoy teaching in public health is the vast backgrounds that people come to public health with. And I think that really enhances the classroom experience in having people from such diverse backgrounds all sharing the public health framework to tackle problems.
And can I just say on that, thinking about my colleagues who have the same roles, whether you've got an undergrad in research, biostats, nursing, physio, it doesn't, a public health degree kind of polishes them all beautifully, and no one really asks what your undergrad is, I think, in the work I'm doing. So I don't think it really matters, and you all can end up in the same role really, which is good.
Yeah, that's great. Now the question from one of the people watching online is, would studying this Masters allow you to become an epidemiologist, or is there a further qualification? Do any of you guys have a comment on that?
I think an epidemiologist is the role that you apply for, and that what that looks like really depends. So it's like being a health economist. Am I a health economist? Probably not, but my role sometimes, if I applied for a role as one, then I am one. I think it depends on the rigor of what the role is.
Yeah. And I think that's one of the tricky things with public health is when you graduate, there's no classic position for a public health graduate. The title doesn't so much exist. So what I really encourage all students coming into is to really start thinking about their career right from the beginning and forge their own path in public health. Look at the range of positions available that include epidemiologists, biostatistician, etc., and really put yourself forward for that. Okay, we've got some more questions here. What proportion of master's students go on to work in the field, and how long before they find employment? We currently have a PhD student who's looking at the whole public workforce across Australia. And I don't actually have those figures to hand, but I really hope to be able to share them with you soon. But we do have the vast majority of graduates going on to find employment within 12 months. And I believe the starting salary is somewhere around $75,000 to $80,000 for graduates within Australia. Okay, so just looking down the questions as well. What's the next one there? For dissertation, is it the same as a research proposal in terms of the depth of research? Elsie, are you able to answer that?
I just saw another chat that we were needing to wrap up. I'm just aware of...
okay, sorry. Thank you so much. I'm kind of not watching the chat. I'm busy.
That's right. I'll answer it until we figure that out. Yeah, I think it is. I think it is the same. And I think that links as well to your previous question, Siobhan, around do you come out an epidemiologist? I talk a lot about the thesis that I did and how that links to my experience. And I'm sure you guys doing the pracs the same. It's like if you had a major in economics, you can use that and talk to it. It's the truth of where you spent your effort. Okay, thank you everyone. I'm finished.
Wonderful. Thanks so much. If anybody wants any more information, please go to the postgraduate information series and we can help answer any of your questions there. So thank you so much.
Thanks.
Thanks, guys.
Thanks, everyone.
Thanks. Bye.